Hello there. Welcome back to PhysioBeast. Today, I once again have a physio subject for you regarding a specific issue. It should be of particular interest to runners since it's an injury, if you can call it that, pretty much exclusive to them. We're talking about shin splints. You can sometimes find it referred to as medial tibial stress syndrome, but its much more common and recognizable name is shin splints. Even if you haven't heard the name before, but you're a runner, you have shin pain and you don't know what to do with it, it's very likely that you're experiencing shin splints, and in that case you should probably watch this video in its entirety. Let's start off by describing the symptoms of shin splints so that you can decide if you may in fact have it. As I said, it is pretty much exclusive to runners, although it can be sometimes encountered in some other activities and sports. According to the data I've seen, shin splints affects around 13% of runners, but based on my experience, I think it may be a bit more than that. The symptoms of shin splints are incredibly specific, and it's really difficult to confuse it for something else if the runner will accurately describe them and the therapist will properly interpret them. Shin splints manifest itself as an irritating, pulling type of pain on the front of your shin. It gives you a sensation as if your tibia, which is your shin bone, was hurting. Some people may even describe the feeling as if the tibia was about to break. The onset of pain is very specific too. It appears when you begin to run, then as you keep going it gets better or even disappears, but then comes back when you stop, often even worse than at the beginning. From that point it can continue for different lengths of time. Aside from running itself, the pain can also appear during some eccentric type activities such as going down the stairs. If this description sounds familiar to what you're experiencing, then you're most probably dealing with shin splints. Unfortunately, it isn't very difficult to fix. But ironically, it still isn't sufficiently described or understood in medical community. Nowadays, more and more people, especially physically active people, first seek help of a physical therapist when they hurt or get some sort of injury. But still, a large portion of the population first goes to a doctor. Doctors hardly ever give correct diagnosis on this, having no experience in the area, and the runner remains without help or relief and may even decide to just give up running. As a fun fact, I've experienced this myself. Years ago, when I used to run a lot and haven't yet had sufficient knowledge about the subject, I was dealing with shin splints a couple of times. I was seeking the help of doctors who were prescribing different medications for connective tissue strength, which had no effect whatsoever. They were running imaging tests, which showed no abnormalities. So having not received any help, I started to study the subject myself, and I've actually learned how to deal with this issue. And it's really astonishing that it can be so simple and yet so many doctors, but physical therapists too, haven't figured out how to deal with this quickly and efficiently. So what causes shin splints? We have to look at the lower leg anatomy. In your lower leg, there are actually quite a few muscles, and some of them lay deeper beneath the ones that are more superficial. Some of those attach partially to the periosteum of the tibia, as well as to the interosseous membrane spread between the lower leg bones, tibia and fibula. Those muscles are primarily the soleus, tibialis anterior, and tibialis posterior. When they are overloaded and under a lot of tension, some of that tension is being transferred onto the periosteum and interosseous membrane, and that causes your tibia pain and the specific sensation of pulling on the bone. Okay, so now we roughly know what the issue is. Now how to deal with it. The first thing you should start with is simply stretching the lower leg muscles. My preferred method of doing it is by standing in front of a wall. Lean against the wall, set 1 foot forward and 1 foot back. The leg back is the one being stretched. Make sure that the heel stays on the ground and that the knee remains straight. If you're dealing with shin splints, this position may be enough for you to feel an intense stretch. Hold that position until you feel the tension letting go a little bit. It should take about 10-15 seconds, but if it still doesn't let go, you can hold it for a little bit longer. After that, let's call it one set, relax, reset, and get in the position again, this time a little deeper. you can increase the stretch by either getting the back leg further back or leaning even more against the wall. Remember to keep the heel on the ground. Once again, reach the point of increased tension and hold until it lets go. Do 3 sets like this for each leg. If you're having shin splints only in one leg, you can perform only 1 or 2 sets for the unaffected leg. If you can't feel any significant tension, even in a deep stretch position, let go. And in a lot of cases, it will be enough. If you start stretching your lower leg muscles this way every day, you'll very likely feel significant relief after just a few days. Once the problem is gone and you get back to running without any issues, you shouldn't have to stretch every day anymore, just from time to time as needed. Another useful form of therapy worth implementing besides stretching is direct manual therapy on the overloaded muscles. Sometimes stretching on its own may not be enough, and in that case you have to implement it. You could try to do this yourself by finding sensitive and sore spots, but it's better to seek help of an experienced therapist. We use techniques such as compression, grinding, and what's called a deep tissue relief. It should be pointed out that such a therapy on heavily overloaded muscles can be quite intense and painful, but when implemented properly, it can be really effective, so enduring those few seconds is absolutely worth it. As I mentioned, some of those troublesome muscles, particularly the soleus and tibialis posterior, lay quite deep, so sometimes dry needling can come in handy in order to effectively reach the correct spots. So shin splints is just another example of an irritating and actually quite common issue which often bothers runners for way longer than it should, while it can really be quickly and effectively fixed. But you have to keep in mind that muscle dysfunction must have had a cause. Even if you've dealt with the problem and gotten back to running pain-free, you should try to figure out what caused it in the first place, because if you don't identify and address the initial cause, the problem will likely sooner or later come back. So what could have caused the muscle dysfunction in the first place? There are a few possibilities. If you're just beginning your journey with running and are already experiencing this problem, it may be the issue of your running shoes or your running technique. It's also worth considering your running route. Running on hard surfaces like concrete all the time or running downhill a lot may also contribute to the issue, especially at the beginning while your tissues aren't yet sufficiently adapted to the stress of running on a more challenging route. However, if you've been running for some time now and have not experienced this problem before, you should consider what changes have occurred lately. Perhaps you've changed your running shoes, your regular route, or the surface on which you run. Sometimes people get shin splints when they switch from running outdoors to running on a treadmill, let's say during winter time. Or perhaps you've had some injury recently, which might have affected your tissues and as a result your running technique, even if you haven't noticed it. So analyze, by yourself or with your therapist or a coach, what could have caused your shin splints. If you identify and address the cause correctly and implement proper therapy, you now have all the tools to deal with this irritating issue. I hope that this advice proves useful. Let me know what other subjects you'd like me to cover. As usual, I invite you to follow my Facebook fan page and to subscribe to the channel. Stay strong, and until next time.